I want to touch on a very important topic. It's the management of high blood pressure, also known as hypertension. It affects millions of people across the globe, but if you're looking at specifically at the US population, it affects nearly half of the adults, which is roughly 120 million people. If left untreated, it can lead into some serious issues and complications. So I'm going to talk about what hypertension is, why it's important, the risk factors of hypertension, lifestyle modifications that can help prevent and even control your high blood pressure, how medication plays a role, and also monitoring and follow-up. And last but not least, how you can empower yourself to be better and control blood pressure as well as you can. First, let's define what high blood pressure is. It's when your blood pressure is consistently elevated, and we're using the JNC8 classification, which is a blood pressure that's above 140/90. And if you're at home, if it's above 135/85. High blood pressure is also known as a silent killer because most of the time you won't even feel any symptoms. And the only time you'll know that your blood pressure is a problem if something drastic happens or you're developing stroke-like symptoms. You might be wondering, why is it important to manage your high blood pressure? If high blood pressure is left uncontrolled, it can lead into some serious health issues: heart disease, kidney disease, stroke, retinal issues as well. According to the World Health Organization, hypertension affects about 1.13 billion people worldwide. So this is something that is just not a rare disease. It definitely affects people across the globe. Let's talk about risk factors. It's important to know what your risk factors are. Also, it's important to know what your risk assessment is. There are two categories we look at. One is modifiable and non-modifiable. So modifiable risk factors would be ones that you can control. That'll be everything kind of related to lifestyle. If you're a smoker, which increases your risk of high blood pressure. Stress, right? So anxiety is another one. Poor eating habits lead to obesity. Physical inactivity is another one. Excessive alcohol consumption. Now, the ones that are non-modifiable, those typically refer to ones that are from more genetically linked or hereditary. Obviously, as you get older, age plays a role. Your arteries do get stiffer as we get older. Family history of high blood pressure, and even your ethnicity. So understanding your risk factors plays a key role, and it's also important for your healthcare provider to understand those as well. One of the most effective ways to manage your hypertension is to look at lifestyle modifications. Let's kind of dive into some key strategies to help you better manage your hypertension. So the first thing we always talk about is diet. The most well-known diet is the DASH diet. It kind of focuses on whole foods, which includes vegetables, fruits, whole grains, and really low-fat dairy, while reducing kind of saturated fats and cholesterol. That is kind of the most well-known and well-accepted diets to use if you have high blood pressure. If you're looking at diet specifically, we also know that salt plays a key role. If you can reduce your salt intake, it can lead to some positive and improvements in your high blood pressure. Another hidden factor is low potassium. So make sure you keep your potassium levels up. That can also help better control your blood pressure. Next will be physical activity. So I would aim for about 150 minutes of moderate to vigorous activity per week. If you wanted to perform about 30 minutes a day for 5 days a week, or if you want to stretch it out over a 7-day span, that's a little over 20 minutes a day. I would really emphasize on increasing your heart rate. That's going to help with generating blood flow. It definitely has a lot of other positive cardiovascular effects, not just lowering your blood pressure. So it can definitely improve other aspects of your life as well. And if you're asking me specifically what exercise that I recommend, I typically prefer to do HIIT exercises. That's high intensity interval training. And I typically do about 10 to 15 minutes of that specific training, and then I incorporate some resistance training. On off days, I also include more cardio. So I believe in having kind of a diverse exercise regimen or different exercise modalities throughout the week to kind of keep your body engaged and making sure that it's well stimulated to also improve your cardiac function and also generate good health for you. The third thing we always talk about with kind of lifestyle modification is weight management. We know that weight plays a key role in keeping your blood pressure kind of elevated, so making sure you work on ways to reduce your weight. One of the key things I focus on is restrictive diet or restrictive management, or also known as intermittent fasting. I believe there's a window that should be for eating and also a window for fasting. That fasting state is so important because it helps your body kind of recycle things that has accumulated over time. It also reduces insulin resistance, and it actually converts your body into a more of a fat burning state, which is important important obviously for reducing weight. Obviously if you have some excess fat, it will help kind of reduce that as well too. I hinted on this earlier about low salt. So ideally is trying to keep salt less than 2,300 milligrams per day, which is kind of the ballpark amount of salt you should kind of reduce that. So a part of that, we want to make sure we keep your potassium levels at a good range, making sure that's not becoming too low. We also know that that's been linked with hypertension as well. Another key thing to focus on is really stress management. Everyone knows right now there's plenty of stress to go around, but I wouldn't focus on preventing stress from coming and preventing all these kind of complications coming at you. I really focus on how do you really react and manage your stress. And so that's really going to be the key, and that really is what's going to make a big difference. A lot of it is honing in on healthy exercises that you can do, yoga, meditation, deep breathing, mindfulness. All these things are super important that you need to do on a daily basis. Me specifically, I have to do this every day, and I have to do it in the morning. It sets my intention that I am priority number one. So I do about 10 to 20 minutes of meditation in the morning with some self-affirmation. To me, that helps ground me. It makes me present, and it keeps me alert in the morning, but also better approaches the day coming. When lifestyle itself is not enough to keep your blood pressure under control and normalized, then your healthcare provider may opt to try medication to kind of help with better managing your blood pressure. I know medication itself does have quite a bit of side effects and things you want to worry about, but it also can be very helpful in keeping your blood pressure under control. At the end of the day, it's really to prevent heart attacks, strokes, and really these serious complications when blood pressure is not controlled. So I'm going to dive into some easy explainable medications that your doctor may want you to be on. So the four main categories would be diuretics, ACEs, ACE inhibitors, or ARBs, calcium channel blockers, and beta blockers. So for diuretics, most people know that diuretics are the ones that make you pee a lot. So that's really the mechanism behind it. So it helps your body eliminate excess sodium and water, reducing your blood volume, which then entails and reduces your blood pressure. Now for ACE inhibitors and ARBs, it has a different mechanism. So it actually helps relax your blood vessels. In further videos, I'll go into kind of more of the details on these specific medication and this function. Number 3 would be calcium channel blockers, and that helps prevent calcium from entering the heart and blood vessel cells, leading to lower blood pressure. And last but not least would be beta blockers. Beta blockers help reduce the workload on the heart, and that also will help reduce your blood pressure. Now, it's essential to work closely with your healthcare provider because not all medication is created equal, and everyone's very different. You're going to react to medication different. So most of the time, your healthcare provider will prescribe medication at a low dose and then titrate up to see if you better control your blood pressure, but always monitor for side effects. And each one of these categories have their own specific side effects and issues. And I really want to harp on the most important thing, and really the most important reason why, blood pressure is not controlled is really from medication non-adherence. So making sure you stay on your medications, taking it consistently, it's going to be super important. I always like linking habits together. So if you have trouble being consistent with taking your blood pressure medication every day, I would link it to a habit you have to do every day. The easy example would be brushing your teeth. So obviously you have to brush your teeth every day. Having your medication next to your toothbrush or your toothpaste or your sink helps you remember taking your blood pressure medication consistently every day. Now, it's also going to be important for you to monitor and to have proper follow-up for hypertension. So I do feel that it's really important that you can monitor your blood pressure at home. So that would be investing in an upper arm blood pressure monitor. You can get those on Amazon or any place that sells them, but it is very important. We know that sometimes blood pressure at home can be different from blood pressure in the clinic. Most common name for that is the white coat syndrome. It's also important to give your healthcare provider those specific readings. That way they can help manage your blood pressure. That's also very helpful. And making sure if you don't have a blood pressure cuff at home, you can always go to the clinic. You can schedule an appointment to make sure that you have proper follow-up, because that's the key data points we need to help monitor and making sure that your blood pressure is under control and make the best recommendations based on your health. Along with that too, because when you're on these blood pressure medications, like I say, you may discover that there's an allergy or there's a side effect. So making sure you bring that up to your healthcare team. That way they can make the best judgment on what to do next. And another key kind of point is educating yourself and really knowing that you have the power to make a difference. And so making sure that you know and why hypertension is important, how to manage it, how to better control it, how to improve all these kind of lifestyle modifications, making sure you're adherent with your medication. All these key things are going to be so important and so vital in managing your blood pressure and keeping it under control and reducing your risk for having heart attack or stroke. So I want to challenge you to step up to the plate and making sure that you're there for your body and your health. At the end of the day, it's always going to be a positive influence because you are taking care of yourself and you can do it. In conclusion, we know that hypertension, this really takes a comprehensive approach to manage it, right? So you really have to work on your lifestyle, making sure you do the proper modifications to better control your blood pressure. If you are prescribed a medication, making sure you're adhering with it and taking it as prescribed, making sure you have regular monitoring and follow-up. All these things working close together will lead to better outcomes moving forward. For you, it's really understanding these key factors and how they play a role in better improving your health. It's going to be really important moving forward. And I want to partner with you. I want to make sure that you understand the importance of it and how we can better control your blood pressure. I do feel that it's one of those things that if you take these right steps, you can definitely turn the corner and make sure that you normalize your blood pressure and prevent all these complications from happening. Thank you for watching. I hope you found this information helpful. If you liked it, leave a thumbs up. Also, please subscribe. If you have any ideas or you want other content you want me to cover, please drop a comment in the comment section below. I'm here to partner with you to better improve your health, because if you're healthy, then maybe you also can help out your family to become healthier. You can also help out your community to become healthier as well too. So until next time, stay well and stay healthy. Talk to you soon.